I want to start off by showing you something that was said at today's press conference by the Chief Public Health Officer in South Australia, Dr Nicola Spurrier. Have a listen.
We have no new cases to report, and I'm really pleased with that news. But you might be saying, why have we got no new cases and yet I'm not able to get out of the house?
Peter, it's a great question. No new cases, only 22 old ones, and they're locked down across that state. Can you understand it?
Well, on the data I've seen, I can't quite understand why they've gone so hard. I mean, what they did is have a cluster. It was an escape from a quarantine hotel. But they haven't had, as far as I'm aware, any mystery cases. In other words, cases in the community not associated with this cluster. And they did it with very good contact tracing and testing, find, all the cases, and have got, I gather, about 4,000 people quarantined because they were direct contact. So their contact tracing seems to have worked very well, very quickly. So unless you've got a lot of cases in the community you're worried about, having severe lockdowns, I'm not quite sure how it helps. Now, it'll become evident over the next few days, I guess, but I gather one of the issues they were worried about was whether they had a new different virus that had an average incubation period of 1 day or 2 days and spread readily. Well, this came from a quarantine hotel, and my understanding is it's probably most similar to a UK strain. Now, they've had lots of cases, and I don't think there's any data that suggests it acts like that in UK or Europe or America. So the basis of this, and I think they're worried there's lots of unknown cases, I would think, isn't there. So these harsh restrictions seem a little bit more than is warranted on the data that's available. And I guess in the next 5 days, if we don't have lots of cases appearing, well, it would imply to me that this lockdown was too hard and too early.